Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me is Scott Hutton. He's the CEO of Biodesix. We're going to discuss diagnostic challenges with lung cancer and how COVID-19 has impacted that and what we look like on the other side. Scott, it's great to have you with us. Welcome to Trade Talks.
Thank you, Jill. Happy to be here.
All right, let's learn about Biodesix and the diagnostic challenges that exist with lung cancer and how it's different from other types of disease.
Yeah, all cancers, if we diagnose them early, we have an increased likelihood that we can positively impact those patients. Lung cancer is no different. Nearly 75% of lung cancers are still diagnosed late stage. And of those, they have about a 5-year mortality rate of 80%. So 20% survival rate at 5 years is not strong. So the earlier we can diagnose lung cancers, the better the likelihood we have a positive outcome. So those challenges exist across all cancer types. For us, being focused directly on lung cancer, we try to get to those patients as quick as possible and as early as possible. Unfortunately, screening is not doing its job. I believe last year we had about 4 to 5% of screen-eligible patients actually were screened, leaving 95 to 96% of patients that weren't or aren't. So for us, one of the first things we did is we focused on 2 new products that we launched. Our Notify XL2 product and our Notify CDT product. These are focused on incidentally found lung nodules. And those are going to be patients that present with a lung nodule, it's suspicious, and they have a follow-up visit. Those are going to be early stage patients. And so by introducing those 2 new products, we're hopeful we can help physicians better diagnose and treat lung cancer over the long haul.
And Scott, these solutions can perhaps help personalize a patient's approach to improve their care. Is that correct?
Yeah, that's correct. The sooner we can get to a diagnosis, the sooner we can begin treating. Right now, there's over a dozen approved cancer treatments and combo treatments out there. Not all of them will work effectively on each patient. So we have 2 other products, part of the Biodesix Lung Reflex, a product called Genestrat and a product called Veristrat. These 2 products will provide insights into a patient's immune response to the cancer or tumor, and then they'll also provide insights into that tumor. How aggressive is it? What is it doing? When we give that information back to a physician, we're giving personalized insights into how best that physician can treat that specific patient.
How did COVID-19 impact Biodesix, and how were you able to pivot to continue to provide medical care?
Yeah, the COVID pandemic impacted everybody. That's obvious. For us, being a company that's focused on lung disease, we were able early on to collaborate with pulmonologists, and we learned a lot about what they were seeing on the front lines with COVID. Because we have experience and expertise in developing novel diagnostics, we partnered with Biorad Laboratories out of California and introduced 2 COVID-related tests to our portfolio. One is a diagnostic test, molecular-based. That's the test that you'll administer when a patient is symptomatic. The second is a serology or antibody test. Again, we partnered with Biorad on that also. And so those 2 tests have FDA EUA approval. They were some of the first tests to market, and they're extremely accurate with high sensitivity and high specificity.
Scott, what will your space in medicine look like on the other side of COVID-19? Do you think any lessons were learned from medicine in general?
Yeah, I think we're still learning, obviously, as we reopen. I think physicians are engaging with patients, and I think it starts with patients. The first question is do patients feel comfortable coming back into hospitals or clinics? That's where we've seen telemedicine take off, especially with pulmonologists, thoracic surgeons, and medical oncologists. Cancer care doesn't stop. And so these physicians are trying to find means and ways by which they can engage with those patients. So I think telemedicine is here to stay. I think it'll continue to grow, and why not? We've all talked about the experiences we've had working from home, and I think the same thing applies to patients. If they don't need to come in, let's give them the treatment, guidance, support, and assistance they can get remotely. Procedures are still in question, right? We've talked a lot about procedures returning back to pre-COVID volumes. I think the question is how do you prioritize which procedures to get to first? And so there's still a lot of uncertainty there. But just as much as Biodesix adapted, we think physicians are going to continue to adapt. I think they're going to evolve. most importantly, I'm confident and hopeful that we become more effective and more efficient as we administer healthcare.
All right, Scott, thanks so much for joining us on Trade Talks.
Yeah, thank you, Jill.
And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.